welcome back. This week we're doing stroke. So let's imagine our brain is like a bustling city. And in the city there are pathways with food, with oxygen going to different areas that do different things. A stroke is when those nutrients in our blood vessels, that oxygen in our blood vessels cannot get to specific areas in the brain, causing those brain cells to die. The brain is our control center, and that is where we have emotion, that's where we have movement, that's what controls our speech, our walk, our breathing. And therefore, if there's any area that is affected, the symptoms that we see are directly correlated to the area that is affected with the stroke. There are a few types of stroke. The first one being an ischemic stroke. This means that this blood supply did not reach the area because of a blockage in the blood vessel. And so if you're thinking of it as a pipeline, there's something clogging the area that the blood cannot reach the area it needs to supply. And this can happen with blood clots, this can happen with high cholesterol plaques that go and block the area, causing downstream death of those brain cells. That's called an ischemic stroke. The second type is called a hemorrhagic stroke. A hemorrhagic stroke, if we're going to use the example of the pipeline, that is when the pipeline busts, and therefore the blood goes into the area where the bust is, and therefore the area that needed the supplies doesn't get it, but now we have fluid in the brain, which is always never a good thing. And the third kind of stroke is called a transient ischemic attack. This is called a mini stroke, and mini stroke meaning that it doesn't last. So it's still the kind with the ischemic where there's a blockage, but the blockage doesn't last long. It's transient, and so the symptoms don't last, they don't stay, and therefore they're just a signal that there needs to be some treatment to be able to avoid getting a major stroke. For the rest of the video, we're going to talk about the main warning signs that every individual needs to know. And the acronym that we use is FAST. F-A-S-T. Get help fast. F stands for facial drooping, face drooping. It's a symptom of a stroke. You'll notice that one side of the patient's face will start drooping or get lower. And if you tell them to smile, you'll notice that their smile on both edges does not go up. And therefore you have a lopsided smile or facial droop like in the picture. And if you notice this sign, seek medical attention. F for face drooping. A for arm drift, and this is when someone is told to put two hands in front of them with the eyes open, and if they close their eyes, one arm starts to drift like in this picture. It's an early sign of a stroke, especially if the stroke is in an area of movement or arm strength. A is for arm drift. S is for speech. Speech can be slurred, speech can be very confusing, not able to understand, speech that does not make sense, very highly suggestive of a stroke. And the last is T, time. If any of the symptoms that we have talked about, facial drooping, arm drift, or speech slurring or confusion, time is of the essence. Time is brain. Every second wasted means treatment gets harder, recovery is less likely. And so if you notice any of those symptoms, seek medical advice immediately.